So what is a frozen embryo transfer? Now, during an IVF cycle, we collect the female partner's oocyte, we take the male partner's sperm, and these are fertilized in the lab to create embryos. Now, in certain situations where we cannot put back the embryos in the same cycle, they will be frozen. This technique of vitrification is both safe and very effective. Almost more than 99% of the embryos survive the vitrification technique. It is because of vitrification that today we are able to use all the embryos that have been produced in the IVF cycle. So once these embryos are vitrified, they are stored in liquid nitrogen tanks at a very low temperatures of -196 degrees. Now, whenever the patient is ready for the embryo transfer, these embryos are taken out from the tank. They are warmed in the culture dishes. They are kept in the incubator for few hours, and once we confirm that they have survived the freezing and the thawing process, then these embryos are transferred back to the woman in a prepared cycle. Now, how do we prepare a woman for a frozen embryo? Now, there are various protocols of preparation of the uterus. So, the layer that we monitor is the endometrium. So, patient is called on day 2 of her cycle and she is put on estrogen. Either she takes oral tablets or we apply local creams of estrogen, and her endometrium is developed. It should take, this could take about 10 to 15 days. Once the endometrium is ready, we give her progesterone, about 3 to 5 shots of progesterone, and then the embryos that have been thawed are put back into the uterus. Now, this is called as a hormone replacement therapy, or the HRT protocol for FET. We can also use the women's natural cycle, where we monitor her ovulation and time the transfer according to her ovulation day. Or we can induce ovulation. In certain patients who do not naturally ovulate, we can do ovulation induction, induce the ovulation, monitor it and do the transfer. Now, certain patients like who have endometriosis, adenomyosis, they could have implantation failures, because of which there are certain drugs which could be used to suppress this condition and then go for the transfer. That is called down regulation. So, frozen embryo transfer is one of the protocols that has helped us increase the cumulative pregnancy rates, because when patients go for multiple transfers, it improves their overall IVF outcome to success rates more than 60 to 80%.